Welcome to the Dr. April Jasper Show, relevant conversations for business owners of today. We are grateful to have OcuSoft as a sponsor of our show. Since 1986, OcuSoft has served the community with a unique selection of proprietary brands, from dry eye care and protection with Retain line of artificial tears to eyelid hygiene with OcuSoft Lid Scrub eyelid cleansers essential for maintaining healthy eyes. Zoria Skincare from OcuSoft offers revolutionary products for people with sensitive skin and eyes. Thank you to OcuSoft for being the #1 doctor-recommended brand of eyelid cleansers and providing patients and doctors with products and supplies to continue to keep our eyes healthy. Hi, everyone. It's Dr. April Jasper here, and I am joined by Dr. Hans Fromow Guerra. Did I say it right, Doc?
Yeah, you said it right.
Okay. It's so exciting to be here with him. Thank you for doing this and sharing your information with everyone.
No, thank you, and thank you for having me.
So we are here at the Brain and Ocular Nutrition Conference in Boston, and it is the year 2025. Somebody might listen to this next year, and they want to know when this was recorded. So I want everyone to hear about the data you presented. But before we do that, tell everybody about you, where you practice, what you spend your days doing.
Okay, well, I'm an ophthalmologist. I am a retina specialist in Mexico City. I have a double practice, a research and academic practice, teaching in the Association for the Prevention of Blindness in Mexico.
Wow.
That is the largest ophthalmological hospital in Latin America. I work there as chief of the retina department. And in the other half part of the day, I go to my private practice. That's my daily routine, doing with teaching, research, and seeing patients and doing surgery.
Well, I am very, very interested in the research you presented today. And that is because there are times in my career, my life, working with patients, that we put them on supplements so that they have improvement in their macular pigment. Then we measure their levels, and for some reason, we don't always see a change right away. So what you talked about today is super helpful. So let me read do you have the whole title memorized, Doc? I don't always. It's a long
read
one.
it because I don't know neither.
Okay. It is Intestinal Microbiota Expression Profile. Its relationship with macular pigment levels and consumption of ultra-processed foods in healthy patients and those with age-related macular degeneration. That's a lot.
Yeah, that's a lot.
So where do we get started? Tell me about this research.
Well, the main objective, our main interest is especially to fill a gap of knowledge of other related things that we already know based on science. One area of data is what we know about that our diets influence what our gut microbiome. What's our gut microbiome? Is all those bacteria, sometimes viruses, sometimes all living beings that lives in our intestines, especially the microbes. And those microbes are a little bit different depending on our age and also on our diet. And it's a thing that it has evolved through evolution, co-evolving our microbes as well as us as human beings. So there are differences there. But the profile of these bacteria in our intestines give us different kind of risks or benefits. That's the important part. And as we are changing the food patterns in the world, moving, unfortunately, more closer to consuming more ultra-processed food, these are making big changes it's already known, that are linked to inflammation. I'm not going to go into the specifics, and that inflammations are leading to a rise in different kind of chronic disease.
Wow.
And all kinds of mortality, cardiovascular disease. In the case of the eye health, age-related macular degeneration, and some others. I just mentioned as a background in my presentation a very important study where they studied 156,000 subjects, male and females, beyond 50 years of old, without age-related macular degeneration at the beginning. They follow them on time, measuring exactly what they eat, so to classify the ultra-processed intakes into quartiles. And after 10 years, when they compare the ones in the highest percentage of consuming ultra-processed food versus the lowest, they have a 28% difference in risk of developing AMD. And also, all these patients had a larger proportion of glaucoma and cataract.
Are you looking for a nutritional supplement to help with your day-to-day vision needs? Look no further than MacuHealth. Recommended by doctors worldwide, MacuHealth offers a full line of products designed to support your vision and eye health. Available through eye care professionals on Amazon.com and directly on our website at macuhealth.com. And here's the best part. Use the code OME24 when ordering direct from MacuHealth for special discounts. MacuHealth, nutrition you can see.
Oh my word, that's incredible. So I think we should back up. A lot of people don't know what ultra processed foods are. Can you tell us a little bit about, I think I learned yesterday it's more than 5 ingredients on the list.
Well,
what else?
Probably they don't know, but they eat it every day because here in the U.S., it almost accounts for more than 50% of the food an average American eat comes from ultra-processed food. Ultra-processed food is all those food that are readily to eat.
Okay.
That needs preservatives, needs sweeteners, needs emulsifiers. And when they have more than these 5, that's one of the definition of ultra-processed food. But actually, all these foods that are easily ready to cook or only, it has to need something that not only adds times on the shelf time,
right,
but also are adding other components that is precisely those components alters the profile of our microbes in our intestines, killing the good ones that are related to healthy aging and letting the bad ones, the pathobionts, those that produce pathological conditions, disease, rising up. And this change in the guts is what are linked to these many other diseases.
So how do you use the information from the study in clinical practice? What were some of the results? I mean, we talked about a few. Anything else about this research that really stood out to you that you know would be helpful to us?
Well, our main research is trying to link all that with especially focused on macular pigments.
Right.
How that dysbiosis, that means the change in the microbes on the intestine, are not letting to absorb, probably, that's our hypothesis, the carotenoids, and then or the transportation to the eye. What is the final idea that we have to take into account? When we want to have or change to a healthy lifestyle, it's not only our diet. It's our diet, but we have to see what is our baseline.
Right.
Not only to go and try to calm our mind saying that I'm healthy because I'm taking vitamins or carotenoids that are not vitamins or something else, if we are not changing a complete realm of healthy habits. Eating, exercise, of course, smoking, all those are related. And that's the final part. But why is this important? It's important, of course, for human health all around the world. But for example, in countries like Mexico, that a very large percentage of the medicine is paid out of the pocket. And I don't see that the patient I'm prescribing the micronutrients, in this case, lutein, zeaxanthin, that is focused for age-related macular degeneration, they are just wasting their money.
Right.
Because I'm not advising properly in terms of, first we have to go and see your general practitioner or your gastroenterologist to make the modifications you need in diet or something else so you can be able to absorb these nutrients.
That's good. That's really good advice. So for those of us that are seeing patients in our clinics and taking care of them every day and prescribing supplements, this gives us added information that we can not only advise them on the rest of the things they need to be doing to eat healthy and absorb, but make sure they connect with their doctors. And when I see that number doesn't change on the life meter, so their skin levels aren't changing, then maybe this is part of the reason.
Maybe it's part of the reason, exactly. Of course, we have to think that the nutrient I'm prescribing has to do a long way, has to change into measles in the intestine, so to be absorbed by the epithelial cell, then go through the bloodstream for distribution, and then finally goes into the eye.
So there is hope.
There's hope. Always is hope.
If you're 55, you know you haven't lived the life you should have lived as far as eating, exercising, and all the other things that we're advising. Hopefully people haven't smoked, but let's say they've done things wrong. There's a chance they can turn things around even in their older age.
Well,
I'm going to call 55
I will not
my
call
older age.
55 because it's exactly
They
my
all
age.
know it's my age.
Mine too. But the thing and the change should come earlier.
Yes.
Not at 55. 55, we are late.
Yes.
It is a thing that is cumulative along all lifespan.
And then I will ask you this, being a retina specialist, do you currently prescribe supplements then for your patients in practice?
Oh, yes, certainly. I do it oftenly, and I have a big area of teaching other colleagues in my department, all the residents, to take out these ideas that are just vitamins or placebo.
I love that.
It's not a placebo. It has a very scientifically proven effect of protection and are one of the very few maneuvers we can do for preventing chronic disease in the elderly.
Did you see how passionate he got right there? That tells us that not only do you know it makes a difference, you believe in it, and it could be definitely something that changes our patients' lives for the better forever. I love that. Doctor, thank you so much.
Thank you.
Thank you for your research. Thank you for sharing it, and I look forward to getting the information into more of our patients and our colleagues' hands.
Great. Thank you.